It's that time of year again. Cozy cold mornings, fluffy sweaters, and a sudden chorus of sniffles and coughs and sneezes that fill the air. What is it about these cooler months that brings a wave of seasonal viruses and infections like influenza, RSV, COVID-19, and even the common cold virus? These viral villains really don't care about your holiday plans, unfortunately. But today, we're going to put these viruses under the microscope and really find out what causes them, how you can manage them, how to treat them, and how you can protect yourself and your family, as well as answer your healthcare related questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions and I answer them. My name is Dr. Kamaljit Kaur, and I am a concierge primary care physician here in beautiful Coral Springs, Florida. Let's get to it. Today's first question comes to us from Aaron, and he just reached out to us through our website, allhealthtv.com. Aaron's question is, hey, Dr. K, every fall when the leaves change, I invariably get a cold. You can pretty much set your watch to it. How come scientists haven't been able to come up with a cure for it? I'm just saying. Hi, Erin. Thank you so much for sending in your question, and it's a great one. I get asked this a lot. Now, did you know that there are over 200 different strains and subtypes of viruses that have been associated with the common cold? It's pretty drastic. And in fact, scientists have even discovered a few newer viruses that are also seemingly contributing to common cold symptoms, like something called the metapneumovirus, something called the Boca virus. And no, there's no relation to Boca Raton, so just putting that out there. So as you can imagine, finding a vaccine that can prevent them all or finding a treatment that can cure them all is quite a hefty task. And while scientists are hard at work for it, unfortunately, we just haven't found the answer yet. But the reassuring news is that majority of these viruses and the illnesses that they cause are not severe and they can be managed conservatively with over-the-counter treatments at home. Now, that is a generalization. As I always say, for your personal health, always reach out to your primary care physician so that you can get a plan of attack and prevention if needed. Now, let's get to the next question. This one comes to us from Maurice, who reached out to us through YouTube. Maurice asks, hi, Dr. Kaur. My mother moved in with us over the summer. She's still in pretty good shape, but she lived too far away and I wanted her closer to me. We took her to her new GP and he wants all of us to get the flu vaccine. My wife and I never get the flu, so we stopped getting them a while back. What are your thoughts on the matter? Hi, Maurice. You're such a good son, and I completely relate to your sentiment about wanting your mom closer, especially the older that she gets. You want to make sure that you're there for her and you help her stay healthy. So, if you want to continue to help her stay healthy, I would encourage that you and your wife also consider getting the vaccination. Now, whether or not to get vaccinated, ultimately, I leave the decision up to my patients after I ensure that I have thoroughly educated them and guided them on making the best decision for them. I want my patients and everybody to know that there are benefits, a lot of benefits, and sometimes risks of vaccinations. But the benefits must always and generally do outweigh the risks and the potential side effects. And in those cases, this is why we recommend the vaccines. Now, let's talk a little bit more about it. Everybody, I think, should get the influenza vaccine annually. I get it myself. And the reason for this is twofold. One, you want to protect yourself. If you get the vaccine, you protect yourself against getting the virus, but you also can protect yourself in that if you do get it, your symptoms are not going to be as severe and your immune system is going to have a little extra bit of a boost to help fight the infection. Now, the other part of getting the influenza vaccine, which I think a lot of people tend to forget or ignore or really not give much importance to, is not only are you protecting yourself, but you're protecting your loved ones, your family, and your community. If COVID-19 has taught us anything, it's that viral diseases can spread quite quickly. And in doing so, they have a widespread effect on not only our health, but our well being and really our way of life, right? not only is getting sick just awful and you feel crummy and it's not great, but it can result in days off from work. So that can be money lost. It can result in days off from being there for your family. So if you're a mom or if you're a caretaker, that is going to prevent you from engaging in those responsibilities. But it can also take days off or cause you to take days off from celebrations. So if you get sick and you're not feeling well and you were really looking forward to a holiday party and you can't go, I mean, that's one of those side effects that we don't think about, right? It has a huge impact, a huge negative impact on our health and our economy and our way of life. Now, for those individuals who say they've never gotten sick, so they think they don't need to get the flu vaccine, I like to remind them that there are individuals who get the virus, but just don't show signs of infection. Now, that doesn't mean that it's not doing anything in your body. Your immune system is still fighting hard to get rid of the infection and to cure it from your body. So you're still walking around with it, and you can even be unintentionally spreading it to your loved ones and to your community. Lastly, but surely not least, if you're someone who is 65 or older, or you have multiple chronic conditions, or you have other immunocompromising health conditions, getting influenza can put you at a huge risk of complications that can be life altering and even life threatening. So to avoid all that, I do highly suggest that you think about getting it and get the influenza vaccine. Now let's go to our next question, which comes to us from YouTube. Oh, it looks like we're going to change lanes a little bit here. This one comes to us from our viewer, Rana. And Rana asks, "Hi, Dr. Kaur. I'm 6 months pregnant, and even though I'm 3 months away from delivering, I've been experiencing severe abdominal pain. So severe, it feels like I'm giving birth. So I went to my gynecologist, and he said I had kidney stones. I know I'm supposed to drink a lot of water, but I forgot to ask him what I can and what I cannot eat." Okay, I completely understand. Hi, Rana, and congrats on being pregnant. I'm so sorry to hear that you're also having to go through something that can be quite painful. Kidney stones, I've heard, are sometimes as painful, if not more, than giving birth. So I really, really hope that your condition does cure itself soon. Now, even though the occurrence of kidney stones in pregnancy is rare, it can happen. And did you know that most women who get kidney stones in their pregnancy actually had no history of it at all? So it's kind of surprising, right? Makes you think, well, why? Well, there's a lot of changes that happen in pregnancy that promote the formation of kidney stones in the body. I won't go through all of them. There's a list and then we can get into the details, but the point of it is that it is possible. Now, the environment that's created during pregnancy, even though it can promote kidney stones, there are ways to help treat them. And treatment really depends on the size, the location, and the composition of your kidney stone. And while there are formal treatments that your doctor can prescribe, like medications and even if surgery is needed sometimes, there are some things that you can do and some things you should avoid in order to help with the kidney stone situation. So let's go through them. Here are some of the do's. Now, you want to make sure that number one, you're drinking plenty of water. You want to make sure you're well hydrated. You're giving your kidneys the content that it needs to stay healthy and to help flush out any toxins that are there. Number two, you want to eat plenty of citrus because you want to keep a certain pH alive in the kidney system in order to help prevent and treat those kidney stones. You want to eat foods with a lot of calcium. Now, this one is kind of controversial sometimes because when we say eat foods with calcium, sometimes people think that they should take calcium supplements, but that's not true because you want the calcium that comes with your food because once that's in your intestines and your digestive tract, it actually binds onto what's called oxalate and can take it out of your system. Oxalate is one of the more common chemicals that helps formation of kidney stones. So you want to grab it from the system and, take it out if you can. So helping that eating lots of calcium foods does help with that. Calcium supplements, not so much. Now, you also want to eat foods with vitamin D. For those of you who watched our episode last week, you may remember that vitamin D helps with calcium absorption, so that's always fun. And let's go over a couple of the don'ts, the things that you want to avoid when it comes to kidney stones. You want to limit animal protein because this can encourage the formation or worsening of kidney stones. You want to limit salt in your system. You want to limit sugar, especially processed sugars. And you want to limit fatty foods. So as you can see, basically following a healthy, balanced diet. I hope your symptoms improve and I wish you a healthy and uncomplicated pregnancy and delivery. Now, in case our viewers missed it the first time, here's how you can send in your questions to Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, we're back in the fast lane and we're getting now questions from Instagram. Ooh, this one's from Missy. And Missy asks, greetings, Dr. Kaur. Greetings, Missy. I'm in a bit of a quandary. My family and I have all gotten vaccinated for COVID the last couple of years. We all eventually got COVID, but it was much less severe than I guess it could have been. We've been thinking and talking about getting vaccinated again, but do we really need to at this point? I haven't heard much about it in the news lately. Missy, that's a great question. And thank you for reaching out. Here's what I think. Now, you're right. COVID is much less discussed in the general media, but I assure you it's still very much present and a very big nuisance still for us on this side of the table and for our patients, honestly. I think one of the reasons we don't talk too much about it anymore is because now we have more information on it. We know how to handle it. And really, we know what to do when we have patients coming in with COVID-19, unlike the very early days. And so it's much less scary now and maybe not as newsworthy, to be honest. But like I said, it's still out there. It's important to remember that it is still a serious health condition, a serious viral infection that can lead to even more serious health conditions that can be life altering or life threatening, even. And remember, long COVID is still out there as well. So you may get COVID, recover from it, but then have symptoms that last. So, for all of those reasons, it's still very important to take COVID-19 seriously. Now, that being said, it's important to continue to receive the booster. Now, the boosters are updated and they're getting updated quite frequently, and they get updated every time or most of the times when a new variant is discovered. While we're still learning a lot about this virus, we find that an updated booster is necessary. Sometimes we're trying to play catch up. So, I'll give you an example, and maybe what I think might be happening in your case and in other individuals' cases who think that they've gotten the vaccine and they still end up getting sick. Now, it's possible that somebody gets their vaccine in the summer or the late summer or the early fall, and that vaccine has been based on the variants and subtypes that have come out the preceding year. However, it may be possible that maybe a month or so after you get your vaccine, a whole new variant comes out, and then that's what actually makes you sick. And because it's a new variant, it wasn't in the vaccine that you received. So this is what I mean about playing catch up. And it's just one of the unintended issues that we're having. But the good news is that scientists are hard at work to really grasp and get a handle on COVID-19 and its potential variants. So just like the flu vaccine, the vaccines that come out yearly are supposed to be very, very effective in whatever is running around in the air at the time. Now, the other thing to remember is that you got the booster, whether it was for that variant or not, it's important to know that it's going to allow your system to fight better and to lessen the extent of symptoms that you do get if you contract COVID-19. We have more information now than we did 4 years ago, and that really makes us feel confident when we do recommend the COVID-19 vaccine. And you can rest assured that the science that's behind it now is strong enough to have your best health interest in mind. All right, friends, looks like we have a Facebook question, and this is from Nora. Dr. Kaur, out of all the seasonal viruses, I'd have to say that my absolute favorite is the norovirus. I'm kidding, of course. Every fall, the twins, Kiki and Kyle, come home from elementary school with presents for the whole family. And when I say presents, I'm talking about diarrhea, vomiting, stomach pain, fever, and headaches. How can I make sure that this doesn't happen again this year? Hi, Nora. Oh, I hear you. Norovirus is no joke. And when you say presents, I completely understand because what I like to say is that they are little, they share the love. They share the love of germs and they share the love of infections. But it is a very serious issue. And we need to address it. The good thing is that norovirus only lasts a couple days generally. For those of you who may not know, let's talk a little bit about it. Norovirus is a commonly known infection or virus that causes an infection called gastroenteritis, so the belly bug. Now, there can be different viruses that cause the belly bug and gastroenteritis, but norovirus is one of the more common ones. And it can produce a variety of symptoms, just like the ones that were mentioned earlier. And it has always been a little bit of something to get a grasp on because it comes on real quick and it goes away real quick too. The symptoms, though, can be quite annoying. So the nausea, the vomiting, the diarrhea, the belly pains. It can also cause what we call systemic symptoms. So some people might get a fever from it. Some people might just feel really cruddy and not feeling like getting out of bed and doing anything that day. You might have a reduced appetite. You might have fevers even. So it's a common GI bug that can cause symptoms that are also symptoms of other conditions, like the fevers that you see in respiratory viruses. Now, even though it can wreak havoc, it comes on real quick and it usually lasts just about 2 to 3 days and then it resolves on its own. That's the good news, that it tends to go away on its own. One of the complications that we worry about a lot with norovirus, especially in individuals who are younger or individuals who are pregnant or individuals who are older, is dehydration. Now, as you can imagine, with a belly bug, if you're vomiting and you're having diarrhea, and on top of it, you don't feel like eating or drinking anything, you have a high potential of getting dehydrated, and then that can actually lead to serious health complications. So, if you unfortunately find yourself having this infection, just make sure that you are drinking plenty of water and electrolytes and checking in with your primary care physician. Now, though efforts are underway for scientists to develop a norovirus vaccine, unfortunately, we just don't have one yet. Until then, we recommend the basics to help prevent this. Basic contact precautions, which means washing your hands with soap and water. Now, did you know that alcohol doesn't kill the norovirus? Yeah, that's very surprising, isn't it? Because I know alcohol has been in the media and it's in all our sanitizers, and that's supposed to be the magic cure for a lot of viruses, not norovirus. So just washing with soap and water is going to be your best bet. The other thing to know is that you want to disinfect your common surfaces, your household surfaces, if you're in your office, any kind of hard and soft surfaces that you can if they've been exposed to you, if you have the infection at the time. And one thing to note is that a lot of these standard over-the-counter household cleaners and detergents don't get rid of the norovirus. So you got to use bleach for those. Use it cautiously because bleach can be a little toxic. So just keep that in mind. But yes, bleach is going to be your best bet when it comes to cleaning the surfaces after having been exposed to norovirus. Also, you want to make sure that if you're not feeling well, stay home. Please rest so you can get over the infection and also so you're not inadvertently spreading it to the rest of the community. And then, that can cause a lot of other unintended side effects as well. Remember, if you do fall ill, you want to check in with your PCP and you want to make sure that you're getting your personalized recommendations and plan. And most of all, so you have somebody who's checking in on you to make sure that you feel better in the time that you should. I hope Kiki and Kyle stay well this fall. All right, let's get to the next question. This is very interesting. This one comes from YouTube, and this is from Jake, who asks, Doc, I started having hearing trouble a few months ago, so I finally pulled the trigger and went to the audiologist. His diagnosis was mild bilateral conductive hearing loss, which is quite a mouthful. The audio guy had to rush out of the office, so I didn't get to ask him if it's curable. Dr. K, is it curable? Hi, Jake. Thank you for reaching out. While it may not be as drastic as other causes of hearing loss, conductive hearing loss really depends on what it is caused by as to whether it's going to be something that we can treat or cure even. For instance, if the cause of your mild bilateral conductive hearing loss is cerumen impaction or a buildup of earwax, well, that's a fairly simple solution then. We lavage out the earwax and your hearing loss goes away. But sometimes the cause may be a little bit more involved. For instance, if you have a congenital abnormality in your middle ear, that may require surgery. If you have fluid that's in the middle ear that's causing the sound not to reach into where it needs to, that may require a certain medications or drainage. Either way, you always want to check in with your ENT physician to ask, well, what is causing my hearing loss? Because we always want to get to the root of the problem to know how to treat it best, right? Hopefully, yours is something that can be cured and treated completely, and you can start hearing perfectly again. All right, guys, if you've got questions, we've got answers. And just in case you missed it the first few times, here's how you can send in your questions to Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've got another question that comes in from our website, allhealthtv.com. Now, if you haven't had a chance, I highly encourage you to check it out because it's chock full of a lot of good medical information. Let's get to this next question that comes to us from Cordell. And Cordell asks, "What's up, Doc? Can I get the 411 on RSV? My Grams is staying with us and she wants the whole family to get vaccinated for it. I'm not big on vaccines, but if I have to get one, I want to know more about what this disease is. What you got for me?" Hi, Cordell. Thank you for reaching out and sharing your story. RSV is a somewhat familiar infection for us, and yet different from the common cold, the flu, and coronavirus. So, traditionally, RSV was more commonly seen in children and the younger population. It was not as commonly associated with a disease in adults. However, in the last few years, as you may have heard, there has been an uptick in cases of RSV in adults, and so much so that this has led to the development of an RSV vaccine. Like the common cold, influenza, and COVID, RSV is seen usually in higher numbers in certain times of the year. Now, for our part of the world, this is usually October, November to April, May, and then it peaks around January, February. So it's actually very common to the influenza virus. Now, RSV is a respiratory virus, and it can cause symptoms similar to other respiratory viruses. So upper respiratory symptoms like a runny nose, watery, itchy eyes, ear pain, sinus pain, sneezing, reduced appetite, sore throat, all of that. But sometimes it can also travel to your lower respiratory tract. And if it does that, it can cause breathing issues like wheezing and shortness of breath. Depending on your baseline health status and if you have other health conditions, this may be a mild infection or it can turn into something that's quite complicated and severe. And the older an individual is, the more chronic conditions he has or she has, then the more likely that they are to be negatively impacted by this infection and can lead to serious life-threatening complications, just like COVID-19. So for instance, someone who has underlying heart disease, did you know that RSV can actually induce a heart attack? Yeah, so it's very important to take this one seriously. And that being said, just like other commonly known respiratory viruses, it's important to get vaccinated against RSV too. Now, you want to prevent the sickness not only in yourself, like I said, remember, but you also want to prevent giving it to your loved ones. It's important to note, though, that the current RSV vaccine is recommended for individuals over the age of 75 and over the age of 60 if you have certain health conditions. Now, certain health conditions can also include the fact that if you're somebody who lives in a nursing home or a long-term care facility, if you have chronic heart disease, lung disease, kidney disease, liver disease, or if you're immunocompromised even. Now, getting the vaccine can reduce the risk of contracting the infection and the severity of the symptoms once you do get the infection, if you do get the infection. I hope this helps answer your question, and I wish you guys all well. All right. Now, the next question we have comes to us from Alicia, who reached out to us through our website, All Health TV. Alicia writes, "Dr. K, I recently graduated from college and moved out to LA. My mom keeps calling me to make sure I get the flu vaccine. I've had asthma since childhood, so she gets a little over concerned about me, but I guess I should do my due diligence. So I'd like to ask you, how dangerous is the flu?" Alicia, thank you for asking this question. Now, influenza can be a dangerous and complicating health conditions, like many other respiratory viruses. So let's go through some of the potential complications that we can incur from influenza. Number one, pneumonia. Very, very common because this is a respiratory virus. Number two, ear infections. Also common because your ears are part of your respiratory system. Number three, sinus infections. Just like ear infections, the influenza virus can severely affect your sinuses as well. Number four, dehydration. Now, anytime your body is fighting an infection, it uses all its reserves, its vitamins, its minerals, its nutrients, and its water stores to help your immune system fight that infection. So you're automatically kind of dehydrated when your body's fighting something. So that causes dehydration. But then when you're sick, you don't feel like eating or drinking anything. And then that causes dehydration. So you really want to make sure that you're staying up with your water stores. Now let's get to the next one. Number five, worsening of chronic conditions. Just like we've mentioned with the other viruses, it can certainly impact negatively your chronic conditions. Then you have inflammation of the heart, brain, or muscles that can occur. And number seven, sepsis, which is a severe life-threatening inflammatory response. And number eight, acute respiratory distress syndrome, which is quite severe, quite rare, but it can happen. That being said, Alicia, I highly recommend that you get the flu vaccine. In fact, you may benefit from the pneumonia vaccine as well because of your asthma. Always talk to your primary care physician and always get a personalized plan that's going to be in the best interest of your health. All right, folks, this has been a great episode, and I hope that you have enjoyed learning about all these viruses, what we can do to help prevent them, what we can do to treat them if you do get them, and then how they impact our overall health. With any of these viruses, no matter if it's RSV, influenza, COVID, or the hundreds of common cold viruses, you want to make sure that if you're having symptoms, you get checked out by your primary care physician, you get a personalized plan of attack, and you do what you can to help yourself recover from it and help prevent it from spreading to the rest of the community. I hope you've had a good time, as I have. It's always fun answering these questions with you guys, and I will see you here next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.